Okay, so when dealing with a client with hypertension, which is high blood pressure, so normal blood pressure is 120 over 80. Hypertension is basically starting probably from the region of 140 over 90. So things to avoid are feet and arms overhead during exercise, as this increases the blood pressure and puts more stress on the heart. So anything we can do with exercise, maybe just using one arm up overhead at a time, alternating arms rather than having both arms up. The other thing we need to avoid is the Valsalva manoeuvre. We don't want to hold our breath and put excess strain on at any point either. So basically we want to use alternate exercises so that there's not as much pressure on the heart. The second thing we're talking about is lower back pain. Basically with this we want to avoid any exercises that put strain directly on the lower back. So with squats and things like that, we want to use a Fitball to assist, where we put the Fitball on the wall and then lower the body, basically taking the pressure off the lower back at any point. So we want to use the use of machines or anything like that where the body weight's not directly pushing on the back. We need to keep correct posture, the core in, and make sure that the head's kept up to keep a flat back during exercise, and this will all reduce lower back strain. The last one we're talking about today is knee injury. So again, we want to avoid putting strain directly on the joint. So when we're exercising, we want to use either very small weight, because we want to build the muscle around the knee joint to strengthen it before we put direct weight on and build the muscles up, so that we're not putting strain on the knee joint. So again, we use alternate exercises for this, so you can use the use of equipment and machines so that the body weight is held and the body weight is not directly on the knee joint as well. So use of elliptical trainers and things like that will also take the strain off the knee joint. So we want to check with clients too when they're doing the exercise how they're feeling, and if anything's straining or hurting, basically want to stop the exercise immediately.